65-year-old woman presents with painless progressive jaundice for 3 weeks and dull right upper quadrant pain. She has a long-standing history of gallstones and on examination, no palpable gallbladder and there's mild hepatomegaly. What's the most likely diagnosis? See, previously you might have seen this question where there is a painless progressive jaundice and the answer was carcinoma head of pancreas. On multiple occasions, you might have solved this question. And as soon as you see painless progressive jaundice in the question, you straight away jump and mark option A, carcinoma head of pancreas. But you miss an important keyword here. There is no palpable gallbladder. And you got a crucial MCQ wrong because in this question, the answer was carcinoma gallbladder. Now, why did this happen? Because subconsciously you're preparing just for the question. You're not preparing the concept. Bear in mind, you are just going through the question and not the concept. This is the biggest mistake you guys are doing. And through this question, the examiner wants to know whether you know the differential diagnosis of painless progressive jaundice. Now, when does painless progressive jaundice happen? This is a gallbladder. This CBD is going to join the pancreatic duct, main pancreatic duct, along with your pancreas. So this is your pancreatic duct, which opens the ampulla of Vater, and your common hepatic duct joins the ampulla of Vater, and the bile is drained into the intestine. So you will have obstructive jaundice when there is something obstructing the bile flow into the CBD. So it can be anything from the junction where cystic duct joins or where it enters the ampulla of Vater. So it can be a stone, it can be a malignancy blocking the ampulla of Vater, or it can be cancer of the duodenum. It can be a CBD stone. But what is he asking? He's asking you painless progressive jaundice. And if it's a stone, patient is going to have painful jaundice. So the stone is not an option. Choledocholithiasis is out of the question. Now there are 3 options, right? So if it's a case of see head of pancreas, let's suppose there is growth in the head of the pancreas which is blocking the bile flow. So what happens now? There is obstruction to bile flow, and the bile keeps on collecting to the entire biliary tree, and there is biliary tree dilatation. So you're going to have distended gallbladder, distended CBD, and the distended intrahepatic biliary tree as well. But look at the question, there is no palpable gallbladder. Gallbladder is not palpable. So see, head of pancreas is also out of the question. There's another history in the question. The patient has long-standing history of gallstones. So now what happens when there is long-standing gallstones? When there are gallstones, GB is going to be shrunk. In case of chronic cholelithiasis, the gallbladder is going to be shrunk. And you know, chronic cholelithiasis is a risk for CAGB. So here the answer was carcinoma gallbladder and not C head of pancreas. And now you have gallbladder mass, which has obstructed the biliary flow and which has caused painless progressive jaundice. But since the patient has chronic cholelithiasis, the gallbladder is shrunk, so you are not able to palpate the gallbladder.